I'm Dr. G, and I look forward to a future of healthcare and benefits where we win the battle against mis and disinformation and truly empower the consumer of today. Not everyone understands the difference between mis and disinformation. Misinformation is the unintentional spread of falsehoods, right? So like a rumor, something you heard, you tell a neighbor, that neighbor tells another neighbor, so on and so forth. Disinformation is a lot more dangerous. It is the intentional manipulation of the masses for some sort of gain, whether it's political, monetary, or to build your following of sorts when we think of social media. We know that falsehoods are spreading 6 times faster than the facts because of technology, because of social media. And on top of that, disinformation has really become a huge business. We know that 59 million Americans turn to social media when they have questions about their health. And in the absence of having a doctor, in the context of physician shortages, in an era when it can take up to 6 months to even get a doctor's appointment, this is the issue of our time. It's time for healthcare to take that business back, recognize that health is wealth, and recognize that employer health is public health, domestically speaking. And so when we empower the consumer, we empower businesses and we empower our communities. So when we think about reversing the trends and mis and disinformation, employers cannot ignore it, doctors cannot ignore it, consumers can't ignore it. We have to use the same technologies that are being used to propagate mis and disinformation to actually propagate the facts. Artificial intelligence is a great resource. How do we use that technology to actually get the facts to our consumers, do it in a culturally sensitive way, do it at scale, and we have to increase access, whether that's 24/7 virtual assistants, virtual triage with AI chatbots, or connecting consumers, employees with providers. I think employers have the opportunity to meet consumers where they're at, look for third-party partners that offer that trusted resource. So a healthy population, a productive workforce, a happy, healthy provider who is able to talk to consumers that are open to what they have to say is really critical. And I think that starts today, and that starts with finding that mutual goal and that mutual benefit to all of those stakeholders. Rather than going to your neighbor, rather than going to that WhatsApp group, rather than going to that influencer, just ask Transcarent.